whatever time till 1 o'clock is available, we will avail that time. We will do our maximum. If there is a portion left for the lecture, we have another slot tomorrow where we will continue the lecture. Okay? Please, but I need your attention for half an hour. Okay? Be attentive. It's only no sir. Don't sleep in the lecture. I am sorry, really, it's a bad time for you. This is your break time. This is not a justice, but since we have to cover up issues, we are doing it. Alright, now, a very, very important topic is coming up in the physiological area. Pulmonary volumes and capacities. These are the objectives. Well, pulmonary volumes and capacities. Alright, so pulmonary volumes and capacities. Why are we doing that? Well, different volumes and the capacities of lungs are changed or affected in some disorders. Its application will come in the form of lung function testing. Again, if you want to check the lung functions, you can measure some volumes and capacities, and this will help you in the release of different diseases. Number one. Okay? So that's why we are doing it. Not just that there are few volumes and we are just doing it memorizing. No. We apply this in medicine. We use that in different respiratory pathologies and in different respiratory medicine conditions. So it is very essential to know lung volumes, capacities, how these volumes and capacities change in different disorders, and what are the blood tests or investigations which develop from these volumes and capacities. We'll also make a short list of the lung function tests. What are the possible function tests that we do in the respiratory medicine, which are helpful for diagnosis? Please, very quickly. It's all interaction between you and me. But I need your attention, all of you. Please settle down. Okay. Lung volumes. We are talking about the air which can go inside the lungs. There are some special volumes of lungs in different situations. First of all, we just have to know the volumes. And from those volumes, inshallah, we will develop some capacities by combining the volume. Just like you have the segments in the ECG and the waves in the ECG, and then you combine the waves and segments, you make the intervals of the ECG. Do you remember that? Just like that, we have volumes. And when we combine the volumes, that will give us a bigger volume, which is known as the capacity. Okay? So there are two terms which we will use here in our discussion. One is lung volumes, or the pulmonary volumes, and the second is pulmonary capacities. Okay? 4 volumes, Shabab. Number one is tidal volume, as you can read. The second one is inspiratory reserve volume. The third one is expiratory reserve volume. And the fourth one is residual volume. I believe the first one and the last one you have an idea about. Okay? At least you know something about it. The in-between two, we will discuss more. But tidal volume, please. Okay? You know. Now, I'll demonstrate all these volumes and then we'll talk about that. Just look at me, what I am doing here. Okay? We're talking about the first one, the tidal volume, please. Look at the act, what I am doing during my breathing. Right? I am at rest, a normal person, standing or sitting, doesn't matter. See. What did I do? Actually, Actually, you didn't see me, but I was doing something. What was going on? I was inspiring something, a little amount, and I was inspiring that, okay, under resting conditions. Okay. Now, either you take what I inspired, or you take what I expired. Take any one. Okay. The quantity is same, and that is equal to taqriban 500 ml. Okay. So I inspired, and then I expired. Don't combine them. The air which I inspired, the same amount I will expire also. So there is no problem. It's the same thing. So if you want to check the inspired volume or you check the expired. Check any one. It's the same thing. Same. Well, volume is same, value is same. Now, I'll just define that. The volume of air inspired or expired with each normal breath. Okay? In our respiratory cycle, the volume of air which is inspired or expired with each normal breath under resting condition, it is called tidal volume. Okay? Right? Why it is called tidal volume? You will see the graph inshallah, and you will find out that when we make the graph of this volume, it increases and then decreases. First, the lung volume will increase 500 ml, and then the lung volume will decrease, and again it will increase and decrease. In the cyclic fashion, it goes on. Our breathing never stops. So it goes like this: inspiration and expiration, inspiration and expiration. In inspiration, the volume is increasing, and in expiration, the volume is coming back. Inspiration, the volume is increasing, and expiration, it's coming back. So this is giving you a tide-like thing, okay, a wave-like thing. A wave is being made, and the wave is coming down, and then again, and then like this. Okay. So this volume is known as the tidal volume. Okay. If you are taking inspiration, you will call it tidal inspiration. If you are taking expiration, you are calling it tidal expiration. Very simple. That was the first one. Okay. Now, look at me again. I am going for the second volume, which is inspiratory reserve volume. Look at the demo. I am starting now. Alright? First, watch me what I am doing. What did I do? Expired. Okay. Now, after that, I am doing it again. What did I do? I inspired more. After that inspiration, the tidal inspiration, I wanted more inspiration up to a maximum, which I could. Okay, so, and that was my limit. So I stopped at one point really, okay, because there is a limit. Now, this second part after that, the first part you know, it is tidal inspiration. The second part which I did, which I inspired forcefully and maximally. Okay? This is called inspiratory reserve volume. Okay? This is inspiratory reserve volume. Definition. The quantity of air which is inspired forcefully and maximally after the tidal inspiration, after the tidal volume, the extra amount of air which a person can inspire forcefully and maximally. This is called inspiratory reserve volume. Yani I have a reserve of some volume which I can take from outside. I am not using it right now. I am only using inspiration and expiration, tidal volume. But if I want, I can take extra air inside my system. That extra air is called inspiratory reserve volume. This is the reserve of my lungs, which I use in some special conditions. Okay? This reserve, when I am taking it like this, it will give me a big amount really. It's not little. How much would that be, taqriban? After 500, extra amount which I took inside. Yeah. What is your idea? 1,000. 1,000, make it more. 1,000. No. Go up. Alright, keep going. 10,000. It's 3,000, coming directly to 3,000. That's good. It's about 3,000 actually. 3 liters. 3 liters. Get it? This effort is expanding your lungs. How much? Up to extra 3 liters. This cleaner is module from before. Barnhus liters extra that you're taking is 3 liters. So your inspiratory reserve volume is how much? 3 liters. Is that okay? Now, coming to the expiratory reserve volume, the third one, please. Okay? See, now what I am doing. What did I do? First I inspired, and then I'm doing it again. Look at me. Like this. What did I do? I inspired first, and then I expired the same amount. And 500, I took 500, I expired, but 500, I did extra effort, okay, out of my system. That extra was mawjood in my system already. I did not take it from outside. That was present in my system, isn't it? Look at me. How much am I taking? How much am I giving off? After that, extra. This is already present in my system, isn't it? That reserve which is mawjood in my system is called expiratory reserve volume. Did you get that? Okay. Do you think this expiratory reserve volume will be same as the inspiratory reserve volume which I got? No way, it cannot be. My system has a little reserve only, isn't it? So in 2 lungs of mine, how much would that be taqreeban? Almost, it's 1200 ml taqreeban. 1100 or 1200, you take it as 1100 ml almost. Okay? So about liter, a little more than a liter, isn't it? So this is 1100. Because I did not take it from outside, it was mawjood in my lungs. If I want to expire that extra effort which is coming, it will contain reserve volume, expiratory reserve volume. Alas, that's it. 3. What is the reserve volume? Last one I'm coming to, please. Now you see, please. Expiration normally. After that, I'm doing it again, the same thing. Now imagine, after doing this, how much is present in my lungs. Do you think everything is out of my lungs? No. Some air is definitely there, which is always there, which will be there, because lungs don't collapse. That little volume which is mawjood is called the residual volume. Okay? So, yes. Now residual volume, how do you define that? The volume of air which is present in the lungs at the end of your maximal and forceful expiration. After your forceful expiration, whatever is left in your lungs or mawjood in the lungs is known as residual. Alright? It is the residual volume. It is already after your maximal expiration, whatever you do. After that I cannot expire anymore. So still some air, and that is residual volume. It is about 1200 ml. Approximately 1200 ml. If it is 1200 ml, is it in the 2 lungs or 1 lung? If it is in the 2 lungs, then about 1 lung contain how much of volume? Taqreeban 600 is mawjood in each lung. Alright? If I say I have expiratory reserve volume 1100, which I expired as a reserve. Okay? If it is 1100, is it in 2 lungs or 1 lung? So, what will be there in 1 lung as expiratory reserve volume? 550, nus of this one, really. Isn't it 550? What I am trying to say is that whenever you consider any volume, you are talking about 2 lungs or the whole structure, not the one. Okay? Are you comfortable with these 4 terms? Let's go and make the capacities out of these terms. The definitions I have already given you. Values. Look at the values. Is it okay? Value. Look at the value. Is it alright? Look at the value. Did we discuss all these 4 values? Now, look at the demonstration again, what I am doing, and now you will tell me what is happening and how you integrate the volumes to make the capacities. Okay? You will not do anything but just look at me and simply interpret what I am doing. Okay? how much did I get inside my system? By doing this act, look at the whole act which I did, right? So how much did I get inside my system? 3 or 3.5? What do you think? Do you agree with 3.5? It means I am now counting two things or combining two things. What am I combining? Number one is tidal volume and then HY volume. Okay? Now, let's define this capacity. This capacity is called inspiratory capacity. Because this is my capacity. Okay? Inspiratory capacity is the amount of air or the quantity of air that a person can inspire by the maximal effort he can do. Okay? This includes two things. Upward tidal volume followed by inspiratory reserve volume. Or you can see it's a combination of the tidal volume and the inspiratory reserve volume. Okay? So two things. It is different from inspiratory reserve volume. What was the definition of inspiratory reserve volume? That was the quantity of air that a person can maximally inspire after tidal volume. This is including the tidal volume. So this is a capacity. Okay? Capacity is a combination of two or more than two volumes. So if it is a capacity, is it satisfying the definition of the capacity? There are two volumes module, right? You are combining the two volumes. So this capacity is called inspiratory capacity. Okay? Second one, please. Vital capacity. Okay? Look at me, what I am doing, and then I'll ask you a question. Alright? I'm beginning now. Oh, that was it. No more than that. That was the maximum effort. Now you saw my effort. What did I do in the beginning? And then what did I do as the next step? I'm asking a question. How much air came out of my system? I'm asking the second part. I'm not asking the first part. I'm asking about the second part. I'm doing it again. Sure. I'm blowing in the pipe actually. Okay? I'm putting the air in the pipe. So now think about how much air is coming out of my system. You calculate and you tell me. Yes, okay, you think about it and you tell me that what is coming out and how much is that quantity. What do you think so?
3,000.
4.5.
2.6. 3,000.
Coming out.
1.1.
2,300? Okay, so one answer is 2,300. What is the other option?
3.4.
1,700? Okay, 2.6.
3,000.
4, using 1? 4.6. Okay, alright. One answer is 4.6 or 7. Okay, any other answer? Now, look at this act again and see what I am doing. In slow motion, I am doing it again. What am I doing now? How much have I taken inside? 3.5? Hold it right now. Now, after taking that 3.5, how much did I bring outside? The air which went inside my system from outside, when I'm expiring, is that air also going out? Yes or no? Yes. So it means if I took 3.5 from outside, am I expiring 3.5 hour or no?
Yes.
After expiring 3.5, I also have a reserve in my system module. What was that reserve? And that is the previous 1100 reserve volume. So after 3.5, I also expire because I'm doing maximum effort, isn't it? So what will be the total quantity now? 4.6. Okay, it comes to be 4.6 or 4.7 liters, depending upon the calculation. This volume of air which is coming out is called the vital capacity. Now, Shabab, put it another way, please. When I was inspiring, how many volumes were going inside? 2. But when I am expiring, how many volumes are coming out? 3. So 2 were going inside and 3 are coming outside because the third was module in my system already. I took 2 volumes from outside and I expired 3 volumes, isn't it? The 3 volumes together make the vital capacity. So vital capacity is the amount of air or the quantity of air which is expired maximally after maximal inspiration. The air which is expired maximally after maximal inspiration. So first you maximally expire and then you maximally maximally inspire and then you maximally expire. That air which is coming out is vital capacity. But remember, when you maximally inspire, how many volumes? 2. But when you maximally expire, 3 volumes. This combination of 3 volumes is called vital capacity. It is representing one of your most important lung functions because this is telling the strength of your muscles, your lungs, your system. This is one of the best clinical indicators of your respiratory function and it is used in many diseases, tashkhis of many diseases. Okay? So vital capacity is a very, very important measurement, please. Okay? Now please, are we clear on the vital capacity? Okay, please look. Come on, quickly. Just want to save time, please. Now look. Look at me, I'm doing the third one. And you tell me. Okay? Look at what I'm doing and then I'll ask you a question and then answer that question. Okay? See, I'm standing normally. Now, did you see what I do? What did I do? Tidal. First I inspired and then, right? After my normal expiration, was my inspiration normal? Yeah, like resting person? Okay. Was my expiration normal? Alright. After my expiration, tidal expiration, how much volume is present in my system, in my lungs? 2300 ml. I inspired 500. I expired 500. No problem. Okay? But my system, imagine my system after expiration, normal expiration. How many volumes are module in my system? 2 volumes. One residual volume which is always module. And 1 reserve volume is also module that I did not use. So 2 volumes, 1200 and 1100. If you combine 12 and 1100, what is that? Functional residual capacity. Now, functional residual capacity is made up of 2 volumes, residual volume and expiratory reserve volume. Okay? Out of these 2 volumes, 1 volume is not changeable or it cannot be changed, and 1 volume is changeable or it can leave the system. Which one is changeable? Expiratory reserve volume. And which one is the fixed volume which will remain? Residual volume. Okay? So, functional residual capacity, now I am defining it. The quantity of air present in the lungs at the end of normal expiration. At the end of normal expiration, the quantity of air which is module in the lungs, you say quantity of air? Okay, 2 volumes there. 2 volumes, residual volume and the expiratory reserve volume. Is that clear? Okay. This is functional residual capacity, FRC. The last one. Now look at me, what I am doing. And tell me and answer the question. See, I'm beginning now. What did I do? I inspired maximally. Now, after my maximal inspiration, tell me what is module in my system. I'm doing it again. Now you think about my system, how much air is now module in my system? Everything. 2 volumes were modules from before. Sir? Do you agree with that? 2 were already present in my system when I started. And when I took that, 2 more volumes went inside. Yani, all 4 volumes are now modules in my lungs. If you just add that, it will make 5,800. Okay? 5,000. I think it will come to 5,800. 1,100, 1,200 modules from before. Okay? Then 3,500 is coming here, and that is your total. Alright? It is total lung capacity. The total quantity of air that the lungs can accommodate or the lungs can be filled with after your maximal inspiration, forceful inspiration, this is called total lung capacity. 4 volumes and 4 capacities. Just to check, just see this diagram. Okay? 500 ml. This is 500 ml. What is that? Tidal volume. From 500, if you further stretch to 3,000 more, what is that 3,000? Expanded the volume. Alright? Now, if you are coming down from this point, from end of the tidal expiration to your maximal expiratory effort, what is that volume? Expiratory reserve volume. And what is module always in the lungs? Residual volume. Now, look at the functional residual capacity. What 2 volumes are you combining to get the functional residual capacity? Alright. What 2 volumes are you combining to get the inspiratory capacity? That volume is inspiratory volume. Okay. Now, what 3 volumes are you combining to get the vital capacity? Did you see that? Tidal, inspiratory and expiratory reserve volume. And what 4 volumes are you combining to get the total lung capacity? All 4. Alright? Did you get that picture? I hope this issue is clear to you, the basic definitions of 4 volumes and 4 capacities. Okay? Alright? Same diagram, same thing, the same way. Short forms are given. Okay. The apparatus or the machine by which we measure our volumes and capacities, many volumes and capacities, is called spirometer, and the procedure is called spirometry. Okay? So in lung function testing, this spirometry is very important. This is a Kareem type of spirometry. Now a Jadid computerized spirometry is there, but we do the same thing. We inspire and we expire and we shift. Sir, just join us, there is no problem. Okay? So this is spirometry. Now, from spirometry, you can measure few very important lung volumes or the capacity. The first one is vital capacity, which can be checked by spirometry. The second is your, FVC is the force vital capacity and VC is the vital capacity. I'll tell you the difference. If I do it slowly, like this, it's the vital capacity I check. But if I do it maximum effort, it becomes the 4th one. There is a slight difference between the two, and we'll talk about that inshallah in the next time, that in what condition it becomes more significant. But it's like both vital capacities you are measuring. FEV1, we are holding this term, very important term, and this term will come inshallah in our discussion later. What volumes and capacities cannot be measured by the spirometry? A logical thinking. Can residual volume come out of the lung? So any volume or capacity in which residual volume is module, can you measure that by spirometry? No. So any capacity in which residual volume is present, it cannot be measured directly by the spirometry. You can measure it by some other indirect methods. Functional residual capacity, residual volume itself, and the total lung capacity you cannot measure by this apparatus. We will continue our discussion with the factors affecting the vital capacity tomorrow morning, inshallah. Dr. Ibrahim is here and he will begin the medicine lecture, inshallah. Please welcome. Okay.